Okay, well, good afternoon to all of you. My name is Jeroen de Wolf. I am the director of the UC Berkeley Institute of European Studies. It is my pleasure to welcome you all to today's online event in our Zoom series on how the coronavirus outbreak impacted Europe. And today we will look at the impact it had and has on the Iberian Peninsula with two guests from Spain and two from Portugal. Our conversation comes very timely since we have recently seen new small outbreaks of corona in Spain and Portugal. So there's quite some concern about the current situation. And as you all know, Spain in particular, but also Portugal has been affected in the past weeks and months by the coronavirus outbreak. So we're very interested in following up this situation with our guests. I would like to ask you, if possible, to turn off your video when you attend the meeting. And let me just say a few words about how we will organize today's conversation. I will be accompanied by my colleague Diolinda Adão, who is the Executive Director of our Center for Portuguese Studies. Diolinda will be joining me today as moderator. And I would also like to thank my colleague Julia Nelson, who is moderating this event behind the scenes. The way it will work is that Diolinda and I will alternate questions for about 30 minutes, and then we will pass on questions from the audience. So during the first half of the conversation, you're all encouraged to write down your questions by using the chat function. My colleague Julia will then pass on these questions to me and Diolinda, and we will be happy to pass on a selection of these questions to our guests in the second part of the conversation. So let me now introduce our guests to you. And we will begin in the beautiful country of Portugal, where I welcome Rita Marques, who holds a degree in engineering from the University of Porto and an MBA from the University of Southern California. She was the CEO of Portugal Ventures and is presently the Secretary of State for Tourism in the Portuguese government. I also welcome my good friend Dana Redford, who's the founder and president of the Policy Experimentation and Evaluation Platform, an NGO that supports policymaking in education reform and economic development. Dana has been a visiting scholar at our Institute of European Studies, and we're very proud to count him among our senior fellows. Dana has also worked as an expert for the European Commission, the United Nations, and various European and African governments. We move now to Spain, where I welcome Gonzalo León, who's a professor of telematics engineering at the Universidad Politécnica de Madrid. He's currently Senior Policy Advisor in the Spanish Secretary General for Research and the Spanish representative of the Strategic Forum for International Cooperation of the European Union and Vice President of the Foundation of Technologies for Defense and Security. I also welcome José Luis Muñoz, who's the General Director of EIT Climate KIC Spain. He's a Senior Executive with 35 years of diversified business experience in environmental and energy management, innovation, and international cooperation. So thank you all for your participation. And before we start our discussion on the impact of the virus and how our experts envision also the long-term consequences of the virus outbreak in Spain and in Portugal, I suggest we listen first to how our guests today were personally affected by the coronavirus outbreak. And I will start with the Secretary of State, Rita Marques. Rita, could you perhaps say a few words on how you personally were affected by the crisis in your job, but also in your private life, in your family? Rita, can you please share a few words with us about this?
Yeah, sure. Before I share all all that information, I would like to say hello to all of you and to greet you in a very warm way. and also to thank the opportunity to be among you today. So going back to the question, yes, it affected immensely, either professionally and personally. Well, my agenda or my schedule was kind of hectic, but after COVID, you know, the schedule was even more hectic. So as you may know, we hotels, restaurants, all the infrastructures that are somehow related with tourism, they basically stopped. And so, of course, you know, a lot of meetings, a lot of requests, a lot of legislation. You know, working hours and hours, and the feeling at the end of the day is that it was never enough. Yeah. So about my personal life, well, I'm a mother of 3. My youngest is 5, and my oldest son is 12. So they had to stay at home. So all the schools shut down. So basically they had to go home, study from home, with their parents working a lot, because my husband is a professor in university, so we had to continue all the classes at university, although they were using virtual platforms, so everything was online. Notwithstanding, and we didn't have any aid at home, so no help. So and so basically Monday to Friday we were with the kids, meeting, getting out. Also, I had to travel a lot, and in the weekends I was cleaning everything at home, basically, because we didn't have anyone to help. So, you know, cleaning bathrooms, you know, normal life as anyone, I guess, that is watching us today. So it was, you know, painful times. Fortunately, we have been opening up slowly, carefully. And so most of people, you know, are in jobs, so they are getting out. So we do have some people teleworking still, but most of people are now working in a more normal way, I would say. But still, everything has changed since March. Yeah, definitely.
Thank you so much, Rita. And all the more, we are very grateful for you making time to join us today. Let's stay in Portugal. Thank you. And let's move to our second speaker from Portugal, Dana. Dana, perhaps a few words on how Corona affected you personally?
Yes, well, I have 2 small children, and so preschool children, and so they were at home. Online education has its limits with a 3-year-old, so it's keeping him entertained and you know, doing things. In terms of my professional life, I do a lot of international speaking. So I have had to adapt. You know, I don't have it up today, but I have a green screen, and so when I give international lectures, I mean, I was supposed to be in various places like Jordan, and when I gave a discussion in Ghana, I used this as a tree representative of the economy in Ghana. So you can see ICT behind me. Yes. Is something that's important. So I've changed the way in which I give presentations and talking. So I vary between using different backgrounds if I'm talking about you know, female empowerment, or if I'm talking about emerging economies. So I use backgrounds like this, virtual backgrounds. I also use slides, of course, as I normally would do. And I've continued to work, doing my work for the European Commission, and so, you know, that has gone on online and been pretty seamless.
Yeah, very creative, Dana. Very creative.
Thank you. Thank you. This is, of course, my favorite background.
Yes, yes, we like that one. Thank you. Let's move on to Spain, and let's reach out to perhaps Gonzalo first, if you could say a few words on how you were affected.
Yeah. Well, first of all, thank you very much for inviting me to this conversation. And in fact, I was working at home, but hopefully have no problems at all with COVID in terms of the health perspective. Then no problem with me, no problem with my family. That's okay. My daughter is physician, and then she has suffered a lot because she was in the trenches, fighting every day with the virus, and then it's things are seen in a different way. It's not the same working or teleworking at home that fighting every day with a lot of people with very bad conditions, difficulties. But anyway, I'm a person with a lot of risk factors. I'm 68 years old, plus diabetes, etc. And then I was pressed from my daughter every day. Say, please take care, stay at home, use a face mask, don't leave, blah, blah, blah. And then I was more or less trying to adapt me to this new situation. In fact, I'm living in a small village not far from Madrid. And then one of the initial decision was to stay here until finishing this period. But at the end, I have decided to stay here forever. Then I will move definitely. And then I will start now in summertime to move the things and furniture from my house in Madrid to here. And then, well, I will come back to Madrid if necessary. But they have understood that necessary is something that we need to consider that in a very, very relative terms. And then we need to rethink again why we need to stay there every day. And that is something that we need to learn. Professionally, I worked probably more hours per day with a lot of video conferences by using a lot of different kinds of digital platforms, but no problems at all, except in the evaluation of the students, which is not so easy to do. Yes. But then we could come back to this issue during the conversation. But because in fact, the rest of the meetings with projects, etc., with European Union many times, with other European projects, etc., will run very well by using this kind of methods. Yeah, another thing is just the contact with the students, because probably it will require to think about it for the future.
Yeah. Thank you so much, Gonzalo. Let's go to José. Just a few words, José, on how you personally were affected by the coronavirus.
Well, I need to say thank you, Doctor. Maybe we were not affected on that, and also me and my family. But some friends, they were quite bad in the hospital, and one of my relatives died. This was quite dramatic. The situation. Well, I'm married and I have four children, and I need to say that it has been a very special moment, this period. My child has from 17 to 25, and this is, we could say, quite old for staying at home. And even we are lucky because last year, two of them, they were studying in the States, United States, in Chicago and Indianapolis, and you can imagine on that situation, if this happened this year. That's why we are lucky that maybe they are at home. But also, I need to say that my work maybe has not changed a lot because I'm used to teleworking, in what we're doing. Only maybe I reduce a lot the travels, I used to travel a lot than I was staying at home. This makes quite positive things. But also, I think the most important thing is on a human point of view, in the relations with my children. We have time enough, to explore new opportunities, maybe to make deep reflections. And I think this period has been really a very, very important moment to reflect about what we are doing wrong and maybe what we should change, And it has been really very interesting, because very deep conversations with them. And I like it on this point of view, I like it a lot. Also, it was developed a very, very good solidarity. During this period, there were a bad situation in Spain. There were lack of material in the hospitals, and also we were producing with my children's mask for the healthcare personnel. And even my children's, they were producing with the 3D printer, some pieces to connect the mask with the filters and things, and designing. And it was really interesting, and very good for the solidarity that was implemented here.
Yeah, thank you so much, Jose. Now, before I turn to my colleague Diolinda for her first question, let me perhaps ask an initial question that I would like to address to both to Dana and to Jose. to give us a brief update on the current situation, because here in the United States we have heard about new outbreaks, small scale but still concerning. And the case of Lisbon has been mentioned, also Catalonia, Galicia has been mentioned. So maybe Dana and Jose, if you could give us some updates on what the situation currently is.
Well, in Lisbon, we have some localized outbreaks, mainly in the peripheral suburbs. And unfortunately, like many things, coronavirus affects the poor much more drastically than it does the wealthy. And so it tends to be in poorer neighborhoods. And it's obviously a concern, and people are wearing masks. I think one of the things about the Portuguese experience is we have a strong sense of, I think, solidarity. You see people wearing masks for other people, and people are generally trying to follow the rules. So a bit concerned, but yes.
Yeah, and Jose, just a few words.
Also the same is quite similar here. You know, there are some places, starting Catalonia, also in the north of Spain, but then more and more are happening overall Spain, you know, in some cases. Also, this is probably normal because people is moving. And then also, you know, especially young people, you know, probably they have not realized what important it is to take care, you know, about the situations. And it is understood, you know, that maybe it has been 3 months of lockdown, you know, and maybe they wanted to go to a party, they wanted to go different places, but maybe this is difficult, you know, and then probably some of the cases are related to that, but also it's related for workers that maybe they came from other places. And for this movement of workers in some industries or even on the agriculture.
Thank you. Let me now turn to my colleague Diolinda for her first question. Diolinda?
Yes, thank you. Thank you so much. So I would like to direct my first question to Rita, if I may. And it has to do with, we know that Portugal's case has been quite unique. They instituted very draconian efforts to combat the spread of the virus from the get-go. There was very little lag time before the officials acted and basically closed down everything and sort of contained the spread at the very beginning. And one of the very interesting things that has come out is your office developed a program called Portugal Safe and Clean. And my understanding is that if Portugal was one of the first, if not the first, to come out with such a program. And I would like you to please elaborate a little bit on what this program is about and what are your hopes for it.
Yes, sure. Yeah. Thank you, dear Linda. Yes, in fact, I guess that we were one of the first Europeans for sure. And the information that I got from the World Organization, Tourism Organization, is that in fact we were one of the first in the world also. So when we think about tourism, we believe that instigating trust should be really a priority. You know, people won't travel unless they feel that they are safe. And so trust is something that we really have to work in a deeply way. And in order to instigate trust, so we came out, so some projects came out. So we just, you know, were wondering what should we do in order to instigate trust. And of course, a lot of ideas came out. And one of the ideas was the seal, a kind of a stamp, the clean and safe stamp. And basically, we defined a couple of rules. So of course, we have the law. So we know that restaurants and hotels need to comply with the law, right? But we wanted to move forward. So basically, an extra step. And so we defined a seal that basically all the hotels and restaurants and museums, even guides, taxis, Ubers, that comply with a specific set of rules that were defined by then a couple of months ago. So we launched this on April 24. So it was really in the beginning. So, and so basically we laid down a set of rules, simple rules, and we defined 3 basic characteristics for this stamp. First, everything is digital. So any company goes online, asks for the seal. Of course, they have to comply with a set of rules. Yes, we do know that, but everything is done online. Second, it's free of charge, so we don't have to pay anything to get the seal. And third, so it's digital, free of charge, and we do have, so third, we have some random inspections, and we try to involve everyone in this inspection action. So all of us go online and we can evaluate in a kind of a booking, you know, as we do in the booking platform, that we evaluate and we give a kind of a grade to the hotel that we are staying in. So it's the same thing. So we go online, we classify the hotel and say, yes, these guys are complying with all the sanitary rules, or no, these guys are not really complying. And if that's the case, we immediately send a specific team to check what's going on. So these are the basic characteristics. Up to the moment, we gave more than 50% of all the infrastructures that somehow related to tourism have already got the seal. So it was really massive. And we also invested a lot training all the staff. So more than 50,000 people have been trained to guarantee that all the rules, all the protocols, all the sanitary concepts were well understood and implemented. So it was a really huge success. Very proud of it.
Thank you very much.
Rita, maybe if I may, one brief follow-up for you before we go to the next speaker. As you may know, many of people of Portuguese descent living in California have roots in the Azores. So one question I had for you, is there anything specific that we should know about the Azores, about how the Azores were affected by the coronavirus? Anything you could add?
Yeah, Diolinda mentioned, so Portugal as a whole country, we managed in a very in a very good way, the first pandemic wave. So people confined, so basically we shut down everything and people confined, and we really obeyed the rules. The source was really an example. So we didn't have so a couple of deaths, or even no deaths, I'm not sure. Madeira and source, I'm not sure, but one of them didn't have any deaths. So I guess it was the case of a source. And even Madeira, only maybe 2-3 people have died. So they locked down very early. The rules were really severe. Quarantine was in place, not valid for all Portugal. So only Açores and the Madeira had they went for the quarantine. So the quarantine. And so the rules were really strict, and in that sense they managed in a very an excellent way the first wave, the first pandemic wave.
Yeah, thank you. Well, that's very reassuring. Let me now go to José with a follow-up question about, or rather to Gonzalo. Actually, I wanted to ask Gonzalo about this. Gonzalo, in Spain, of course, the impact of the coronavirus outbreak has been devastating. We have seen here in the United States terrible images, especially from Madrid, with high number of casualties. And what struck me was the effect it had, especially on the elderly, people living in assisted living facilities. Can you tell us a little bit more about why this community was so affected by the crisis?
Yeah. Well, it's clear that the impact on senior people was clearly several times worse than young people, and it's also one of the problems because even the perception of risk was also different depending on the type of population, no? And then one of the problems we have at this moment is just to convince young people that they have risks not only for them but also because they can produce contagion to other people. What has happened with senior people living in residences? These residences are basically not hospitals, and then it was here First problem is that they haven't internally all medical equipment that could be necessary to have a good treatment inside the residences. The only possibility was to move them to hospital, but the hospital were saturated. And this is one of the difficulties. Then at the end, the peak of the curve, we had the whole sanitary system completely blocked. I remember, for instance, speaking with one of the intensivists in La Paz, which is one of the large hospitals in Madrid. Then they had 15 floors. Initially, 2 were for infectious diseases, and then in 2 weeks they moved everything. They transformed the whole hospital, and then 14 floors were basically devoted to this kind of patients. Then even the specific rooms for specific care attention was just well, they were transforming everything, no? And then it was a problem that maybe nobody was assuming that the evolution of the pandemic at the very beginning was so fast to overpass every capability that the hospital had at this moment, you know. And obviously residences with senior people had also another problem because they couldn't move people to other places, no? Right. And then on the other hand, another problem, which is also very difficult, was the high number of sanitary people, physicians, etc., with simply they were contagious again. I remember that the figure was more or less 50,000 within the sanitary people. Yeah. It was terrible because they will have another problem in parallel.
Yeah. Very good. Before I go back to Diolinda, perhaps José, a brief follow-up, perhaps, in your experience on what happened in Madrid, how the senior people were affected.
Yeah, well, I think maybe it was not only in Madrid, you know, it was in many places in Spain, also in Barcelona, you know, even in Valencia, you know, but I think it was the lack of prevision of all that, you know, because the hospital, why the healthcare personnel were infected? Because they have not the right tools for working with that. Even you know, the mask, you can imagine, we were working at home to produce such a mask in the village where I live. We were producing for the hospital, you know, because there were no supply from that. It was not prepared. Then these people need to deal with the virus, and you can imagine, that's why maybe they were infected. And then also, I think it was the reaction in Spain was too late. You know, maybe also, you know, where there is an emergency, you need to forget political issues on that. When you mix that, that's the problem, you know, because on an emergency, all the people work together to try to solve a solution on that, you know, and this is, well, what I have seen.
Thank you so much, Jose. Let me now turn to Diolinda for her next question. Diolinda?
Yes. So my next question is for Dana, and it touches a little bit of what we talked about. So my question addresses the work that you do, and you're working to promote educational and technology advancement. So in a world increasingly dependent on technology, how do you propose to develop policy for the promotion of social inclusion and education in a reality that clearly marginalizes those that have the greatest need for these for such benefits and for the benefit from such policies?
Yeah, well, that's an excellent question. We have, I mean, in the European community where we develop projects and things, I mean, the pandemic has put online education into hyperdrive much more than any European project could ever do. And certainly it's been something that the Commission has tried to promote over many years. I can say that I personally had a friend who started an initiative to try to get laptops and tablets for children who didn't have those resources, and that there have been some exchanges here in Portugal in that regard. For younger children, of course, where online education is not as effective, for example, in our school, they sent some coloring materials and other things. But this question of equality, and certainly we see the divide now. I mean, the divide between those who have the digital resources and those who don't. This is quite a concern. I think that we know over 10 years ago, there was a policy here in Portugal to try to get laptops to young people, which, you know, this is part of this initiative of a computer under $100 or euros. And we still see that need. If we talk to those in higher education, I think it's even more prevalent. I was speaking with a director of with a large European portfolio of online and offline courses and masters and PhD, and he said to me, "I will probably not consider ever again a course that doesn't have an online component versus you know, a mixed component." So you know, it's something where I think we're seeing a lot of change. But the real concern is how we bring everybody along with us. And that has to be a concerted effort by government and by the private sector.
Yeah.
I would like, actually, if I may, to ask Gonzalo to elaborate a little bit on that, since this is your particular field. I think I'd like to hear what you think the future will look like, or how do you expect it to go?
Yeah. Yeah, let me comment that Dana was presenting the problem with the digital divide with children, but we have suffered a lot with university people because basically for international students, because they had the only possibility to connect them is just to use a smartphone. And with this is the only possibility, that is 4G. But not more. Then because they were living in an apartment, a rented apartment, they're living with other people, and they don't have a connection to internet because they have a face-to-face teaching system. They don't need it. And then suddenly, from one day to another, they realized that they need to have a very good connection, to have a lot of video conferences, to accept labs, to have a remote labs, to have even a PC with the capability to have a virtual machines and so on. And then they discovered that we're not ready for that. And this again, we were trained. And in a public university, that is not easy with the administrative barriers we have in Spain, just to buy a lot of tablets, etc., and then to distribute them with some cards to connect the internet with better bandwidth. But at the end, we realized that is not easy, and we cannot consider that everybody will have at home a very good internet connection. I was working in Africa in several countries many times, no? And then I remember years ago when there's nobody can assume that everybody will have a pen and paper, and they will need to distribute them. Maybe not now, but years ago it was common. Then now, well, we cannot assume that when you enter the university studies, I need to do the same. But we have suffered something similar, trying to redistribute these kind of things, because you know they could follow that. Then we need to consider that the situation is not the same for people living in Madrid forever because they were born here, and people from other countries that they had a very, very weak system to be able to follow the courses. And then it's just a good lesson for the future. Because now we need to start the process of planning for the next academic year with several scenarios. The scenario where the outbreak is more or less under control. The scenario where we have some problem but not too much. The scenario will be again to a confinement system, etc. And then we will need to live with a lot of risk. Then I think that the level of risk that the society needs to consider for everybody, even for institutions, is very high. And then we need to manage this kind of risk in a way that was not necessary to do in the past.
No. Maybe before I have a question, my next question would be a question for Rita, but maybe before I move to Rita, I wanted to reach out briefly to José to see if José has anything to add to this important topic.
Well, this pandemic has demonstrated the importance of the information technologies, you know, and how important it is that it is needed to arrive to all the people. You know, this is a tool that should be for all the people. If not, even we are creating more differences and we are increasing the gap. You know, that's why I think this is something very important. Then second, maybe it has created a new way of doing things. And maybe also this is linking with some good things, because we have understood that we can do many things at home, but we are not prepared at home. Even our houses are not prepared for being long time there, or maybe being the place for working or studying there. That's maybe this means to reflect on that. I fully agree with what has been said.
Yeah, thank you so much, Jose. Let me now turn to Rita, but before I ask the question to you, Rita, just a reminder for the audience, if you have any questions yourself that you would like to ask our speakers, please write down your question in the chat function, and my colleague Julia will pass on the question to me and Deolinda, which gives you also an opportunity to participate in the discussion. But coming back to Rita, so Rita, you as Secretary of State for Tourism, a question specifically on tourism. Many Americans, as you know, love Portugal, have been in Portugal or would like to discover Portugal. What message do you have for these people? What should they know about tourism in Portugal? What risks are there? How should they prepare? What can they expect when they arrive in Portugal? What message would you have for them, Rita?
Well, my first message is that all the good things that have made Portugal to be recognized the best destination in the world for 3 times in a row have not been affected by COVID. So our history, our culture, our sites, so our gastronomy, our weather, our hospitality, our people, we are here. We will welcome everyone that would like to visit us for sure, and we'll continue to work with this mindset. So we'll continue to fight to be the first or the best destination in the world for sure. Of course, we all know that things have changed. So we all know that now we do have new protocols in place related with the physical distance, using masks, cleaning a lot or washing a lot our hands. But going back to the seal, so we established those rules back in April. So everything is open now. And the last mile of the unlock period was opening up the beaches by June the 6th, so already 1 month ago. So and it's we were, we really celebrated that event, opening up the beaches, because a couple of weeks ago we were not sure if we had all the conditions to open up the beaches. And as you may know, Portugal is recognized to have wonderful beaches. Not only about the beaches, but it's also the beaches that one of the assets, great assets that we do have. And so basically we celebrate that moment, because from that moment on, everything is open. So for those Americans and for those Portuguese related, so maybe some Americans do have family they have family in Portugal. My message is that we continue to have all the conditions. So all the conditions are here, all the assets are here, and we will make a huge effort to guarantee that you are safe in our country. We have though new rules as for the flight connectivity is concerned. So all the Americans are most welcome to travel to Portugal as long as they have valid tests, a negative test, 72 hours. So they have to make the tests before the flight. And up to now, the information that I've got from the flight carriers is that the flights that we have a good load capacity factor, meaning that they have a lot of passengers inside. So they do have tourists in the plane. So the people are flying to Portugal, either to Lisbon, and it has already been mentioned. So we do have some issues in the outskirts of Lisbon and not in the tourism areas. And as long as you follow the rules, I think you'll be fine. So it depends on all of us. It depends on you and on me, on everyone, to follow the rules, and as long as you do that, you'll be fine for sure.
Yeah, thank you so much, Rita. Go back to Linda for a follow-up.
Yes, if I may have a follow-up question for Rita. I just my example, I am planning to travel to Lisbon on the 18th of this month. Hopefully I will be able to. I am sad to say I can no longer go on a direct flight with FLAD. I hope to have that again soon. But my question is about the 72-hour, because I would like to know if there are provisions for someone like myself. I will have no way of being able to meet that requirement. The time it takes for me to get tested, get the results, and travel to Lisbon puts me outside of that window. So how am I going to do this? Could you elaborate on what people who can't do that, who can't fit those 72 hours, how are they going to be able to enter the country?
Yeah, we are developing a huge effort in order to have those testing facilities in Portugal. So as soon as you arrive, if you didn't present a valid test before you checked in, you can make the test here in the country. Of course, it's kind of a tricky way to sort it out, because if the test is positive, then you will have issues, and basically you will have some costs because you have to go to the hospital and so on and so forth. And I have to tell you that only at this stage in Portugal, only less than 1%, to be more exact, 0.4% are in the hospital. So most of the people that are infected are at home. And so for those who are traveling, so either if you have a positive test, then either you go to the hotel, or if you want to pay, you can go to the hospital. But again, most of the treatment can be done at home. By the way, during the emergency state, when a couple of months ago, when we were in the lockdown period, our hospitals, the average capacity was 50 to 60%. So we never reached the limit. So we're just far from from the limit. And the way we managed that is that people were at home, unless they were, they belong to the risky groups, but most of the people were at home. And so we had a bunch of students and nurses calling to you when you were at home 3 to 5 times a day, asking for all the information, temperature control, if you are feeling okay, and if it was not the case, of course, an ambulance will take you to the hospital. So we really responded, and going back to the creativity and innovation, and going back to the issues that some of the panelists raised about, being innovative, being more digital. I really believe that in our case in Portugal, even the healthcare system, we managed to be creative enough and to be innovative enough in order to not to reach the limit of our hospitals, and we succeeded on that.
Yeah. Thank you so much, Rita. Now, when I look at the questions from the audience, I see that many people in the audience have questions about the economy, the effect that the crisis had on the economy. So let me maybe turn to Dana and José for a brief comment on that. We all know that the coronavirus outbreak had an effect on the Spanish and the Portuguese economy, but how profound was this effect, and what type of support do you think is needed to rebuild the economy at this point? So perhaps Dana first, and then José.
Sure. I think one thing I wanted to add to Rita's comments, and also I think something that's important also from an economic sense, especially from an American perspective. We have so many issues right now in the United States about immigrants, and one of the things that I have the greatest pride about the Portuguese side of me is that Portugal very rightly decided that everybody who was in the country when the lockdown went into effect were treated like citizens. Everybody had the same rights to go to the hospital, to be treated, to be treated fairly, and those who were having immigration problems, stayed. So I think, there's a progressive nature to the Portuguese politic here, and to the will of the citizens that I think is very encouraging. In terms of the economic costs, this is I think something that we will only see in the next quarters, really, because although the systems are set up differently here in Europe than the American systems, where we're getting checks in the mail, and we have other protections here in place in Portugal for workers. So there hasn't been as wide an unemployment problem as there has been in the United States. But again, we put the country at a greater debt ratio, which is problems that we saw in the previous crisis. And I think the main thing is we have to get innovative, which we can see from what our Secretary of State for Tourism has done, and her team. And we can also think about the other creative measures that we will try to use to get back. And obviously the recovery will not be an even type of recovery. Certain sectors will return stronger and faster than others.
Thank you, Dana. Jose, for a follow-up?
Well, I think this situation, this crisis, has also been a really good opportunity, to change the things that we are doing. And I think innovation is very key here. But also, especially the strategy of the European Union, on the Green Deal, we can see that maybe working for climate change also, this is a big opportunity that we have now. You have seen now that even this has had a positive effect, not only in our indicators, but also on the biodiversity and things like this, but also now appears new opportunities. And this is in what also we are working on, that is how to transform what we are doing, and then take this challenge, this problem that we have and we are facing, to develop a new opportunities. And we have that. Probably we need to rethink about some of our sectors. And also is the moment maybe to implement key strategies on that, especially at European level, but also in Spain. Now in Spain we have the law of climate change and energy transition, and also all the action behind that. This is a whole and long-term framework that could create stability, for investments, and is a new way of doing things. And this is also actions, on cities. This is also actions on industry. This is also actions in other places. Of course, that there is also a big challenge, and also we are going to lose a lot of jobs on that. But this is an opportunity also that we can take it on that. And then also it's important to work now on that, because the situation also on an economic point of view is dramatic. It's dramatic, not only the losses that we have, but also the moment in what we are now. Because this is not a problem for only one single country. This is a problem that has happened, in all the world.
Let me maybe, before I go back to Diolinda, follow up briefly with Gonzalo, because Gonzalo, Jose did mention the European Union. And as you know, there's a discussion going on now within the European Union on how to best provide aid to the countries that were most affected by the coronavirus outbreak, and Spain is one of these countries. So from your perspective, Gonzalo, what type of support is needed at this point for a country like Spain?
Yeah, I fully agree that at this moment European Union is very important, because we cannot invent our national policies without considering what is happening in Europe. And then in this way, and here in Europe we have an opportunity. I'm in favor of more Europe in this discussion, and then I think that we have here an opportunity to reinvent a little bit what should be the competences of Europe in the future. And probably we'll need to move and to transfer more competencies to the European Union and moving more money to them. At this moment, is just 1% of the European GDP for the European budget, and maybe it's not enough. And then we have also a fragmented system of competencies in many things, even in health. And then of course we need to have a different system. This is an opportunity, and this is a political problem at this moment to find an agreement between North and South, East and West of Europe, with different feelings, with different histories, etc. But my feeling is that it's necessary to find a solution as soon as possible, because if possible in July, because if not, it should be very difficult to think about the next period for 7 years, even to finish on time the Horizon Europe, the new program, where the Commission, apart from requesting 100 billion, they are now putting even the idea of 13 more. And then we need to have an agreement as soon as possible, because if not, we cannot get internally at the national level the right policies for doing that. Even policies not only for innovation, should be policies by considering also the industrial policy as a part of it, education policies as part of it, that all of them are closely related at this moment.
Yeah. Thank you so much. Now let's go back to Diolinda for the next question, Diolinda. Diolinda, we can't hear you.
Sorry.
You're muted.
Yes. So my question is an audience question. And the audience is wanting to ask Rita if she could elaborate a little bit on the UK's exclusion of Portugal, with such it surprised us all that, for instance, Spain was included in their safe list and Portugal was not. And we wanted to hear about this. The person who's asked about your thoughts and about the if there may have a long-term impact on Portugal's tourism as well as Spain's.
Yeah, we were surprised as well as you guys were. Well, we have been, and going back to the Europe's question, so we do believe that Europe could have defined the parameters that could be the right ones, the right parameters to measure the situation in each country for us to compare ourselves and to see where we are going. And unfortunately, it was not the case. So basically, member states, and of course, UK is not a member state, but I'm talking all the European countries, have not reached an agreement about the criteria that should be used when they are evaluating the situation in each country. And that was really the case. So basically, the UK decided to choose one parameter among a set of parameters that could have been chosen. So of course, and that was really the case. Well, basically the UK evaluated the countries where they would like to have the bubbles, what they call the bubbles, the corridors, only taking into account the new cases in a 1,000 group of people, 100,000. I'm sorry. And Portugal had at that time not very good numbers. Of course, when you compare again the number of deaths, or when you compare the number of people that were in the hospital and all the other factors, we were doing great. And at the end of the day, I do believe that we are doing great when compared to other countries. But, you know, it was not enough to convince the UK. So we are in an open dialogue with UK, showing that we believe we are a clean and safe country, going back to the seal, so using the same motto. So we are in a clean and safe country, and that we are prepared to manage a peak if a spike if it happens. Of course, uncertainty is around. We are doing the best that we can. But again, we feel confident that the decision is going to be reviewed soon. About the consequences, well, it's, you know, British market is very important to us, especially in the tourism sector. So last year we welcomed more than 2 million British in Portugal, especially in Algarve and Madeira. And for instance, if you look to those two destinations, you can really conclude very easily that we didn't have any major troubles there. We don't have any major troubles there as far as the pandemic is. So we really believe that decision is going to be reviewed. So we hope so. Notwithstanding, you know, if the decision is kept, we will continue to fight back and to show that we are a clean and safe country. And most of all, you know, we know that we are doing the best that we can, and we have been praised by, you know, all over the world, I have to tell you. So, of course, Brits are important to us, but, you know, the most important to us is that our people are not dying, our people are feeling safe, and we do believe that Portugal had an excellent response to the pandemic, after all.
Yeah. When I look at the questions from the audience, I also notice a couple of questions that specifically look at the effect of the coronavirus outbreak on migrant workers. And Dana has briefly addressed this topic when speaking about Portugal. So let me perhaps turn to José and Gonzalo. We all know that migrant workers are very important to the Spanish economy. They do very hard work, very important work, but they're also very vulnerable. And when they're facing such a crisis, there's a very high risk of these people becoming affected. So perhaps Gonzalo first, and then José. Anything you can share with us specifically about how migrant workers have been affected by the virus?
Yeah. In fact, one of the last outbreaks this week in Catalonia, in Lerida, was basically with migrants working in agriculture fields to pick up the fruit, and then it seems that they have a condition where that's very difficult to do. It became a huge political problem, not only in Spain, but across Europe. And then we're suffering a lot in the last years with non-controlled migrants coming from crossing the Straits and the Mediterranean coast to reach Europe in any way. But it's true that the control of this kind of population in case of outbreaks of the pandemic should be much more difficult than people more or less controlled in cities. And this is a huge problem for the future. Another thing is about another type of migrants worker, which is our students coming from abroad, which is also another problem that we need to deal with seriously. I was also listening to news from the United States this week about the problems from people if they are receiving classes on face-to-face or online, etc. We are now in Spain exactly the same problem, and we will see what happens with Erasmus, which is one of the most important, relevant programs in Europe for moving students from one country to another.
Yeah, thank you, Gonzalo. José, for a follow-up?
Well, what I would like is to make a reflection that probably what has demonstrated this pandemic is that it is needed additional integration in Europe. Because, you know, doesn't make sense that we have only national policies for such a common problem that we have. And even, you know, these kind of workers that we have, these are legal workers, that's why that are moving on a free way around Europe. That's why maybe it is needed some kind of coordination, you know, between countries. Also, it's the same like this, you know, in some cases, you know, there are places where you can go or not. I think should be created maybe next time, or to be prepared for next time to have a common European response for that. And then also to help each other to solve such a situation, you know, and I think this is something important.
Yeah.
More Europe.
Coordination, more solidarity. Yeah.
More Europe.
More Europe.
Very good.
Yeah.
I see that it is now 1 o'clock, so unfortunately I will have to conclude our conversation. Let me start by thanking the audience for joining us and for sharing with us your questions. Also would like to thank my colleagues Diolinda and Julia for assisting me at this event, but of course a big thank you to the 4 guests we welcomed at today's event, to Rita, José, Gonzalo, and to Dana. Thank you all so much for making time and for being with us today. Thank you all, and goodbye to all of you. Thank you.
It's a pleasure.
Thank you.
Thank you.
Bye.
Thank you.
Bye.
Thank you.
Bye
Have a
bye.
good
Stay
rest of
safe.
day.
Thank you.
Bye bye, and stay safe.
Bye.
Bye bye. See you.
Bye. Thank
Hope
you
to
so
see you
much.
soon. Bye bye.
Thank you.